The CDC has extended the no-sail order for cruise lines, and the order, which is about 20 pages long, was a doozy. Now, the new no-sail order goes to September 30th, 2020. There are a couple of caveats where it could be rescinded earlier. However, at this point, with COVID cases rising like crazy, it does not seem like that's going to be the case. September 30th looks like the new date to look at before cruises can come back. Now, before that, the previous order was set to expire on July 24th. Obviously, we are not out of the woods with COVID yet, so it's going to be a while longer before cruises come back. So let's dive into that 20-page extension of the no-sail order. Now, we've gone through and read it, and what jumped out to us was how critical the CDC seemed to be of the cruise lines. Now, we are not saying that cruise lines aren't without fault or that there weren't COVID outbreaks on cruise ships. Of course there were. But what is surprising is how blunt the CDC seems to be in their criticism. So let's get into what the CDC had to say. Starting off, from March 1st to July 10th, the CDC says that there were nearly 3,000 cases of COVID-19 or COVID-like illness on cruise ships. Now, this includes nearly 100 different outbreaks. Even today, the agency says that 9 ships have, quote, ongoing or resolving, close quote, outbreaks on board. So there's still COVID on cruise ships among the crew. In the last extension back in April, cruise lines were required to issue a no-sail order response plan. This written plan was required by the government to prevent, mitigate, and respond to the spread of COVID-19 on board to ensure a safe work environment and disembarkation of crew members. Under a section of the order titled Difficulty of Cruise Ship Operators in Submitting Appropriate Response Plans, the CDC said that as of April 29, 2020, they had received response plans from 7 different cruise companies representing about 110 ships. However, the CDC says that, quote, the plans as initially submitted by the cruise lines were incomplete and did not fully meet all the requirements of the April 15, 2020 extension. One plan even required 7 rounds of revisions. According to the government agency, by July 10th, cruise companies had reduced the number of ships they plan to operate in the US to just 49, so from about 110 to 49. By that date, however, July 10th, only one cruise line with a single ship, Bahamas Paradise Cruise Line, has submitted a response plan that met the CDC's required elements. Beyond that, the agency listed out numerous issues it had encountered regarding the no-sail order. In a section called Examples of Potential Non-Compliance with the Extended No-Sail Order, the CDC highlighted several instances where it had concerns dating back to April 2020 through today. This includes incidents from a number of cruise lines, including Holland America, Royal Caribbean, Norwegian Cruise Lines, and even Disney Cruise Lines. Among the issues cited were everything from confirmed cases of COVID outbreaks on board some ships, to crew not wearing masks, to inadequate distancing during meals. In one case, a cruise line allegedly had ship-to-ship transfers of crew that didn't meet the CDC's criteria of recovered from COVID-19. Now, the CDC also said that of the 49 ships that currently sail or plan to sail in U.S. waters, there are 10 that are, quote, provisionally red. This means that at least one case of COVID-19 or COVID-like illness has been reported in the last 28 days. In summation, the Centers for Disease Control put its thoughts bluntly, quote, the difficulty to date of cruise ship operators to submit and adhere to appropriate no-sail order response plans during a time of limited operations, as well as ongoing concerns relating to non-compliance with disease prevention protocols and continued outbreak of COVID-19 on board cruise ships, highlight the need for further action prior to resuming passenger operations. The order went on to say, quote, the director also finds evidence to support a reasonable belief that cruise ships are or may be infected or contaminated with quarantinable communicable disease. As a result, persons on board or seeking to board cruise ships may likely be or would likely become infected with or exposed to COVID-19 by virtue of being on board at a time when cases are being reported in increasingly significant numbers globally. One thing that jumped out in this report is that even with the steps cruise lines have put into place to help create a more healthy atmosphere for passengers and crew, the CDC seems to have found some fault. It specifically mentioned the new partnership between Royal Caribbean and Norwegian Cruise Line and their Healthy to Sail alliance. Now, these two cruise lines are working together to come up with better ways to keep everybody healthy on board. This partnership brings together a number of respected experts, including former Health and Human Services Secretary Mike Leavitt and former FDA Commissioner Scott Gottlieb. Their plan is to help create steps to sail again safely in the face of this pandemic. However, the CDC seemed to have issue with the fact that the group's goal is to provide steps to safe cruising in, quote, over the next few months. As well, with other cruise lines taking their own steps to safety, the agency pointed out the lack of consensus among cruise ship operators. Following the release of the updated no-sail order, Cruise Lines International Association, or CLIA, an industry group of which most cruise lines are a member, stated the following: as reflected in today's announcement, CLIA and its member lines remain aligned with the CDC in our commitment to public health and safety. We are also pleased that the CDC has announced its intention to issue a request for information about the industry's resumption of passenger operations. As we continue to work toward the development of enhanced protocols to support the safe resumption of cruise operations around the world, we look forward to timely and productive dialogue with the CDC to determine measures that will be appropriate for ocean-going cruise operations to resume in the United States when the time is right. Bottom line, reading through this report, we didn't see a whole lot to get excited about. The CDC was pretty harsh and critical of the cruise lines. Now, while cruise lines could be given clearance to sail sooner, given the language in the order and the sharp rise of cases of COVID-19 in the US, it seems reasonable that September 30th, 2020 would be the earliest date that cruise lines would return to sailing. Even then, this order could be extended again. Now in June, Cruise Lines International Association, which is an industry trade group that all the cruise lines are members of, announced that its members would stop sailing until at least mid-September. Carnival Cruise Line extended their suspension at the time until September 30th anyway, matching the expiration date of the CDC's new order. So in other words, the actual impact of the no-sail order extension isn't too much for the lines and the passengers, given that cruises were mostly suspended until then anyway. However, only time will tell if the cruise lines are actually able to return September 30th, or if this suspension will go on even farther into the future.